Stem cells are used for many reasons, to help relieve joint pain, promote faster natural healing, and a bunch more. Dr. Stephen R. Lucy is one of the orthopedic surgeons with Jacksonville Orthopaedic Institute, joining us today. Good to see you.
Good to see you again.
I always like talking to you about this stuff out of your office, because it means I'm doing okay. But let's talk about your practice and what you do first.
Well, I'm an orthopedic surgeon. I specialize in sports medicine and know you well from the days with the Jaguars. As my athletes have gotten a little older, now I'm doing more and more joint replacement type surgery and treating more and more wear and tear and sports-related arthritis.
And that's what we're talking about today, is lipogem fat stem cells?
That's correct.
We talked about stem cells before, but these are different.
Right. You know, we've always heard that fat is bad.
Yeah.
You know, you shouldn't eat too much fat, you shouldn't be fat. And what we're learning is there's actually a lot of good things in fat. And what is in there is there are some mesenchymal stem cells, which are reparative cells. There are some anti-inflammatory cells in fat. And actually, as we get older, we still maintain those same stem cells in fat, whereas we lose some of that from our bone marrow, which is a usual source of most stem cell injections.
Because that's the one we talked about before, that you get the stem cells from the bone marrow. This is coming from your fat, which sounds a little less invasive.
Well, it is a little less invasive. For the ladies, it's a little like a liposuction type procedure. Most of it comes from the belly, which many of us have too much fat cells. Somebody from like yourself might not be a good candidate for this, but most of America has some extra fat to spare, and this is a good way to put it to work.
Well, what is it putting it to work? What's it actually doing? What are you doing with it?
Well, what we're using it for mainly is in those patients who have joint complaints, shoulder arthritis, knee pain, ankle arthritis. They're not quite ready to have a joint replacement or a surgical procedure, but they know they need some help. So what we're doing is we're putting these fat cells in their joints. We process them by washing them, microfragment them, and so they're in an ejectable form but still retains all those good qualities. And once they get in there, they kind of like are whistling out to all the cells, hey, come on in here and help me heal. Help me make this knee or this shoulder better. So they don't do all the work, but they call in everybody to help them. Using
the body to heal itself.
Exactly.
All right, so what should somebody expect if they're going through this procedure? Because this is a relatively new, what's this, a year old?
Well, it's just got FDA approved actually this year, and I was at the American Academy of Orthopedic Surgery meeting and went to an instructional course lecture by some guys I really respect, very high quality orthopedic surgeons who have been doing this. They went over to Italy, were trained with it, and we're getting quite good results. So I visited with them, learned how to do it, and just started doing it beginning in the past year in Jacksonville. And what you can expect is it's about an hour-long office procedure. It's not a operating room procedure. You harvest the fat by taking some of by sucking this out through a little bigger needles, but after you've numbed it up, you filter it, shake it up, make it into an injectable form, and then under an easy local inject it into the joint. Then it takes a month or 2 months to start seeing some effects, sometimes even 3 months. But what we're hoping for is not to make you feel 30 years younger, but that we can eliminate at least 60 to 75% of your pain level.
Well, pain level for, let's talk about who this is good for. Who are the people sitting out there right now, and who are the people that are already coming to you for it?
Well, these are people that are active people generally. They want to stay active. You know, they want to keep playing tennis. They want to keep playing golfing. They want to keep riding their bike and doing things. They're not quite ready for a joint replacement, but they hurt and they can't do exactly what they want to do. So they come in to see me, we take x-rays. We usually try plenty of other things before we go to a relatively expensive procedure like this. The standard things, physical therapy, anti-inflammatory medicine like Advil and Aleve. Sometimes they may have a steroid injection or another thing. But when that easy stuff fails, this is the next option, sometimes in a lot of people, rather than surgery.
So it's kind of like an intermediate step if you've talked to a doctor and they say you might need surgery down the road, but right now just ice it and Advil. This might be an intermediate step to avoid and prolong surgery?
Exactly, and we really recommend you see your orthopedic surgeon because they have the full gamut. Some of the regenerative medicine clinics are one-trick pony. That's all they do. We will see you, treat you for other conservative ways before we recommend even an injection type procedure such as this.
Good stuff. Good to see you again.
Good to see you.
And we want to thank Jacksonville Orthopaedic Institute for being here and sharing their services and this amazing technique and new program they got. For more information, visit joi.net or you can call 904 JOI 2000.